Hello once again, and thanks for tuning in. I'm Holly Shields here for Kalkine Media, and welcome to another edition of Executive Corner Expert Talks. In this edition, I'll be shining a light on MediKane, and the best way to do that is to sit down with none other than CEO and Director, Mr. Rod Lewis. Rod, thanks very much for joining us today.
Oh, thank you for the invitation.
It's an absolute pleasure. Now, first and foremost, MediKane aspires to lead the food as medicine health space. Can you tell us a bit more about this concept?
Yes, indeed. Food as medicine relates to products that have been independently shown to have direct health benefits to the human body. And our products have had extensive clinical and scientific proof that we do indeed provide medical benefits. The base technology has been shown to nurture the microbiome and to improve gut health. It's clearly known by clinicians and academics in the biochemistry space that a healthy gut improves the health of virtually every part of the body and most of the subparts. We're now offering products for blood sugar levels, cognitive, joint and inflammation. So it's a natural market for our technology.
I can imagine so, and I think you must have seen a real surge in demand recently because it's quite a popular concept that I'm sure that's reflected in demand.
Yeah, it has indeed. Both here, we've got a US company subsidiary, and even more so in the US, they're looking for preventative health products. I mean, it's certainly happening here, but and that's great for us because this is all about preventative health. You know, we're great believers in conventional medicine. If you're really acutely sick, you need a targeted solution. Drugs do that normally very, very well. But if you want to just improve your general health and indeed specific health in some conditions without drugs, preventative health is the way to go, and food as medicine works very well.
You're quite right there. And I understand as well that MediKane has spent over a decade building the foundations to take your products global. What's been the strategy throughout this journey?
Well, it's a very good question. Rightly or wrongly, we decided to start building product development, scientific and medical evidence that our products actually do exactly what is said on the label. And while that's right, and I think it's still right for long-term value, it's cost us a lot of money and a lot of blood, sweat and tears. And so our strategy was get the products right, get the evidence right, and then go out and selling. We've literally spent millions on product development and clinical trials. We've even had clinical trials in the US. And now that the products are accepted, not just medically, but also consumers have to buy them and like the taste and the convenience of the packaging, all that. Once we've got all that done, which we have now, we're starting to market the products.
Well, it's safe to say that you've really come a long way here and seen a lot of success. And on those products as well, could you tell us a bit more about your current offerings and their health benefits?
Yeah, sure. So our original product was based on the gut health, microbiome health, as it relates directly to helping people manage blood sugar levels. We've got ample evidence demonstrating that it does that. It's got some specific micronutrients in it that specifically help the insulin management within the body, but it also works through the other mode of action is through the microbiome. So helps and manage blood sugar levels. Now, we don't use the word diabetes because we're a food label product, but we can happily claim that we help blood sugar levels because that's what the clinical trials showed us. And of course, a blood sugar level is a metric we can measure in everyone. And the other thing that this product has been shown to do, we're not promoting this too widely as yet, it reduces the massive fluctuations in blood sugar levels. As you would know, blood sugar levels go up and down normally and naturally and in everyone and indeed in animals all through your day. But when the fluctuations are too big, then people get into trouble if they're too high. And if they're too low, if blood sugar gets too low, very sadly, people actually pass out in the middle of the night and die. So we have found that it reduces the extremes of blood sugar level management. We've got a lot more work to do with that. And we've done some preclinical work with the Royal North Shore Hospital. So I should go on. I didn't complain the other products. So we've currently got a market, a product called MediKane R. I don't have a sample with me, which I should have. MediKane R is just simply focused on good gut health. All the products do work on the gut, but we've formulated each one slightly different to optimize its target and good gut health. It feeds the microbiome with short-chain fatty acids, improves its health, and stimulates function of the intestinal tract. And the other product at market at the minute is just a pure, straight, natural dietary fibre, insoluble dietary fibre called sugarcane fibre, because it's from sugarcane.
Right, and that is really important, I feel, especially just to touch on the blood sugar levels. I think lots of Australians do suffer with that. And then you've got products that obviously address gut health, which I think is quite underrepresented as well. You don't hear too much about that. So it's excellent to hear that you do cover those issues.
Yes, indeed. We've actually, after many years of work, we've realised the best way to try and explain it to people. We're now into explaining the products to our markets, and we relate it to a tree of health. So the trunk of the tree is good gut health, good microbiome health, good gut health, and the branches are the very specific things, and we reformulate all of them. So it's taken us a long while to develop it, and even longer to try and decide the best way to help explain it to people. Healthcare professionals understand it, but people that are not trained don't always get it instantly. But a simple concept like that makes sense, it seems, to everyone, and it's scientifically proven. So, we're on a good thing, I think.
Absolutely. That is, I think, a very good way to put it for laymen as well. So very well said there. And I understand as well that MediKane also has products meant specifically for dogs. Is your company planning to further expand this product line?
Yeah, we do indeed. Well, firstly, animals have a very similar biochemistry. As we all know, most of the DNA in us and animals is 90-something% the same. So they suffer the same health problems as humans do. And interestingly, obesity is a major problem in human health almost globally. And fortunately or otherwise, people spoil their little dogs, and little dogs and big dogs have similar problems. Labradors, which we all love, get arthritis, and little dogs suffer all sorts of things from bowel health, and our products do the same in a little dog's biochemistry as it does in a human. So we appointed a JV partner. We wanted to focus on humans within our business. So we appointed a JV partner who's a very skilled marketer and very, very focused on animals. Its business name is MediKane and the brand name is Chica. Just recently been launched. He's got a range for dogs, cats and horses. And of course, MediKane supplies all of the products because it's very similar biochemistry to the human products.
That's great to hear. It sounds like a large venture to take on their whole nother market, but you're making some great headway, safe to say. Now, I'd just like to ask you, perhaps, if you could explain in a nutshell about MediKane's ingredients and how they're useful in food manufacturing.
Right. So FoodasMedicine is a very important way to look at food ingredients. Ideally, you want the things you eat to be healthy and free of adverse side effects, but also wherever possible, you want them to have a positive impact. So that's not just MediKane, that's what our products already do, but we can now provide our ingredients in bulk to food manufacturers here and overseas, who also want to have higher label claims and higher effectiveness of their products and higher acceptance by consumers, because they can claim, rightly so, that they have FoodasMedicine ingredients. So we've got consumer products today that helped FoodasMedicine in our own products, and we can offer it to large corporations. But we can also improve the yield for baked goods. One of our ingredients helps improve the retention of moisture, and it improves the yield for bakers and various baked goods. And the sugarcane fibre product that I mentioned earlier also in many gluten-free products improves the texture, which has been a problem, texture and mouthfeel. So we've got a big opportunity there, and we've launched it, but we haven't driven it yet, and that's going to happen next year.
Very exciting stuff there. It does sound like there's a lot of ground to cover for you in that area of food manufacturing and a lot of opportunities along the way. So we do look forward to seeing that. Now, just before we let you go, what can you tell us about what's on the horizon for MediKane over the next 12 months?
Yeah, well, we've got 2 more products we're about to launch, a product for systemic inflammation, and the same base technology, but formulated specifically for inflammation, where we've got good patent coverage, and also a product for joint health. We already provide one of our customers with a product with collagen in it, and the product for the joint health product will be, have already been demonstrated that it does help joint health, and indeed skin health, because collagen is used in many parts of the body. So we want to launch them. It does 2 things. Obviously, there's volume there, but importantly, it gives us a range to take to retail outlets. Retail chains don't want to stock you if you've got 1 or even 2 products. We've now got 4 or 5, and that will be this year before Christmas. So launching new products off the same proven technology but do different health benefits is critically important to our strategy. And simply, I want to double sales in Australia in the next 12 months at least. And we want to use existing networks. We've signed deals in the UK and the US with the distributors and partners. So we want to make sure we get sales going there, develop networks. I don't think they're going to be big in the next 12 months, but we just need them to be growing. And we also want to align with marketing arrangements, marketing people, marketing and awareness, of which your business is certainly one, to aid brand awareness. You know, we've got the products now, we just got to tell the story. And really, fiscal 24 is our absolute target for strong growth.
Absolutely. I mean, it certainly sounds like you've got a big year ahead of you, and we do look forward to those launches that are just around the corner. I think it was before Christmas, did you mention?
Indeed it is.
Exciting
Well, fingers
stuff.
crossed, but you know, it's only a few weeks away, but yes, that's the intent. And we're on track.
That's great to hear. We'll definitely keep an eye on that going forward. But with that said, thanks very much for making time for us today. It's been an absolute pleasure having you on the show.
Thank you, Holly. Thank you very much. Appreciate the opportunity.
Thank you.
Cheers.
Thanks for your time as well, viewers. If you've just joined us, that was Rod Lewis, the director and CEO of MediKane. And if you missed any part of that chat, you can catch the full interview on our YouTube channel here at Kalkine Media. And do make sure to keep an eye out for them. They're doing some incredible stuff in the space. I'm Holly Shields for Kalkine Media.